Hello all, welcome to another episode of Rusty's MS Adventures. In this video, I'm going to answer the question, what is multiple sclerosis, using simple terms that anyone can understand, and explain some of what happens in a person with MS. Now yes, you could go online, get a definition for MS, and find all the information you could ever want to know about the disease. But unless you're in the medical field, a lot of it probably wouldn't make much sense, and you'd just be overwhelmed with information. So what I wanted to do was provide a simple explanation for a very complicated disease. Multiple sclerosis is a disease in which the body's immune system, for an unknown reason, attacks the protective coating around the nerves of the central nervous system. This protective coating is called myelin, M-Y-E-L-I-N. When myelin is damaged, it's called demyelination. If you watch medical shows, you may have heard the term demyelinating disease. That's basically what that means, is that the myelin is attacked and damaged. You can think of this myelin like the coating around an electrical wire. If you strip off an electrical wire's protective coating, it leaves the wire exposed, unprotected, more likely to become damaged, and overall just not work properly. That's what happens when the myelin is damaged and removed off of nerve. Nerve signals can get disrupted, which can basically wreak havoc throughout the body. It's the central nervous system that's affected with MS, which is the nerves in the brain and spinal cord. These nerves basically control everything in the body, so MS can have a lot of different symptoms. Things like numbness, tingling, vision problems, bowel and bladder problems, dizziness, coordination issues, balance issues, speech problems, and many other things. A lot of people, when they hear MS, think of someone in a wheelchair or with other walking difficulties. While that does happen very often, not everyone with MS will have those issues. One person's MS symptoms can be completely different than the next person's MS symptoms. Truly, no two cases are the same. This can often make diagnosing MS very difficult. Thankfully, my doctor is awesome and thought of MS right away based on my symptoms, but not everyone is so fortunate, and sometimes it can take years to diagnose. When the myelin is damaged, it can often show up on an MRI as a lesion. A lesion is just a spot of damage that is sometimes called a plaque or a scar. The term multiple sclerosis literally means multiple scars. Not every person with MS will have visible lesions on an MRI, but most do. My MRI showed multiple brain lesions, mainly in my brainstem and my optic nerve. There are a few different types of MS. The most common type, and the type that I have, is called Relapsing Remitting Ms. This is where a person will periodically have relapses of strange, varied symptoms, which will last a period of time, usually a few weeks, and then will go away or remit. A person with Relapsing Remitting MS may also have some issues that are constant. For example, I have balance dizziness issues and difficulty focusing my vision. Those issues have been constant for me for over a year now, so it seems unlikely that they will ever go away. I've also had a few relapses of other symptoms, muscle weakness, slurred speech, as well as my bout with optic neuritis and double vision. Another type of MS is called secondary progressive MS. This is where a person who was originally diagnosed with relapsing remitting MS will transition into a progressive course of the disease, where there is just a gradual worsening of symptoms that never go away. Most people with relapsing remitting MS will eventually transition into the secondary progressive MS. It can sometimes take decades, but at some point, like I said, most people with relapsing remitting MS will eventually become progressive. There is also primary progressive MS, which is where it's just a progressive worsening of symptoms from the get-go, and there was never any period of relapses and remissions. There is no cure for MS. It is treatable and manageable, and doesn't really affect a person's life expectancy. So it doesn't kill you, it just adds some complications, difficulties, and often pain to your life. The prescription treatments out there are designed to slow the progression of the disease, as well as reduce the number and frequency of relapses in patients with relapsing remitting MS, but they don't really treat any symptoms. Individual symptoms can be treated with other medications if needed, but most of the time symptoms of relapse will go away on their own without any treatment. So to recap, multiple sclerosis is a disease in which the body attacks the protective coating around the nerves of the central nervous system. This protective coating is called myelin. When myelin is damaged, it can interrupt nerve signals and disrupt communication within the brain and from the brain to the body. There can be a lot of different symptoms of MS, and no two cases are the same. There is no cure yet, but I remain optimistic about the possibility that one day there will be. So, hopefully this video has been helpful to you in understanding more about MS. There's a good chance that you will know someone with MS in your lifetime, and now you can say that you know what MS is and impress them with your knowledge of demyelination. So that is all I have for now. Thank you for watching. Until next time, take care, Internet World.